My name is Tim Davenport. I'm in charge of product optimization at Athena Health. Based here in Boston, I am watching the sun set on the East Coast here. So you'll see the sun moving and me dodging it as I try to balance is looking good on a camera. So I apologize if it gets weird halfway through this. But in my role at Athena Health, I have two teams under me. My product operations role at Athena Health, all of the alphas and betas for R&D tests run through my operations team. On the other side of me, I have a product performance team, and that team is focused on emerging front door care models. So things like value-based primary care, direct-to-employer and consumer models, direct primary care, all hits my team. And we try to optimize the experience for our clients and people who are onboarding to make sure that they are getting the best services from Athena to fit their needed model. What we're gonna try to accomplish today, so a little bit on my background. I joined Athena in 2012 with because I wanted to help disrupt healthcare. And my thinking on healthcare has been, or in anything I do, is that the smartest people out there are always pioneers in another industry. There's always gonna be a brighter company, a brighter person somewhere else, and I like to really borrow from them and figure out what they've solved and see how I can apply it to my existing challenges, problems, my company. So I'm going to start by talking a little bit about how we looked at Amazon for innovation. Back in 2017, I found myself in a role supporting our emerging product services head. And we were basically asked with, using the Athena asset today, what problem can we go solve in healthcare? That's a pretty daunting ask. And so I'm going to talk a little bit how we use Amazon to help think through some of that. Two, you got to be genuine to yourself. We are not a biomedical company. We can't go create, there's a certain swim lane that we belong in. And so let's understand what we can do uniquely to help disrupt healthcare with what we have and what we've been historically. So I'll talk a little bit about our history. And then I'm going to kind of talk about why is Athena at HIM Summit? Why are we being vocal about direct primary care? And then we have a big announcement as well as some asks for this group of people. So if that makes sense, I'm going to go ahead and jump in. Yes, Athena Health is a EMR company. We have a variety of solutions. I'm not going to talk through all the things that we have. Just stop by our booth, Heidi. So, I kind of posed the scenario where in 2017, trying to understand where should we point this Athena Health asset at? What problem in healthcare should we align to? And it was brought to my attention this interview with Jeff Bezos, who basically said he's asked all the time to predict the future, and it's so hard to do. He gets questions asked like, hey, what do you think people are going to do coming out of COVID? How is the economy going to impact Amazon next year? And it's really hard to predict short-term outcomes. But what he can predict are truths that he believes will be there 10 years from now. And as long as he invests in those things, he feels pretty good that they're going to have good outcomes on those. And so for Amazon, it's really hard to imagine that a customer, a user would say, I wish your app just required a few more clicks. I wish it was a little bit harder to buy things. There was a little less selection. And I want that stuff to come a little bit slower. And if you do all that, I want to pay you more. Obviously, those things are not going to be true. And the framework that we kind of think about with Amazon is that they obsess with investing in things that make them lightweight, easy to do business with, easy to derive outcomes. They focus on connecting buyers and sellers to increase access for both parties and driving outcomes. And the outcome that they get isn't always a good one, but if they invest in consumers, they invest in disintermediation, providing access, simplification. Even a failed outcome will get them some learnings to help them move forward, on their journey towards opening up the industry that they're looking to disrupt. And they did this with books to start, but if you look at what they've disrupted since, it's the same playbook over and over and over again. And it's really focused on these three things. So for Athena, we start asking ourselves, what would it take to be more consumer-centric? What would it take to disintermediate healthcare, to make access easier and simplify it, and then ultimately drive better outcomes? And we could have done this a lot of ways. But coming to Athena's history, many of you know this, we were a provider organization to start. Our CEO, Jonathan Bush, and his co-founders wanted to disrupt healthcare and opened up Athena Women's Health. It was a birthing center. And they said, what if we took this marvelous experience and treated it holistically and really just treated women who are having a baby in the way that they deserved, as if this was a miraculous life event, not as a fee-for-service outcome that we have to track and bill for. And so we had a great, not me, I was at the company then, but they had a great run at driving better outcomes, but they couldn't get paid. And so ultimately, what they ran into was a trend in the industry that we all feel and has pushed you all to look at direct primary care, which is the rise in administrative burden. So what happened to Athena was that when we were a provider, we started to build technology to try to predict how to get ourselves paid, do the right thing delivering care, but get paid based off of whatever crazy rules that our payers had. And that created our rules engine. VCs, investment community, saw what we were doing and said, you're going to fail because you're trying to be too innovative on the delivery care. We'll come in and buy that piece of technology off of you, because every provider in our country needs that and could benefit from that. Keep in mind, this is 1996. The internet was just starting. Payers were just starting to put information on the internet. And that's where we were starting to get information to predict when claims would get denied, when things would fail. And so we went down this path for a while, and we were successful. We have 160,000 providers who came to our network because we were so focused on taking work for people, taking the work off of the plate of practices. We were a small doctor's office. We built solution for the small independent physicians. We've always been passionate about trying to preserve the independent physician medical group space. We have grown and done things in larger health systems, but that's where we had started. And we did it by trying to reduce work. But as you saw, although we took more work off people's plates and we're not done, we're going to continue to try to do that for those who try to stick in a fee-for-service business. Claims are not ever going to go entirely away, probably. But we couldn't do enough. And we know that because we are all here because we feel these pain points. We know that providers are burnt out. Employer healthcare costs are rising, and the patients are feeling the burden. The slide that I don't have here, but has about a 30-minute talk track to it, that I actually love the most, is actually looking at each individual in the healthcare payment equation and showing how each of them are actually independently taking action into their own hands and looking to disintermediate, simplify, create better delivery mechanics to our broken healthcare economic system. And in doing so, there is this interesting connection that can be made across providers, employers, even CMS, but consumers who are looking to direct contract, simplify payment, and pay for the things that they want and need to stay well. And that is creating a really interesting a dynamic that Athena's been tracking for several years now and is really interested in trying to figure out how to tap into to accelerate. So I've already jumped a little bit into this, but this is the Amazon kind of consumer access outcome framework. And the question is, how does this apply to healthcare? Well, from an Athena Health perspective, when we were thinking about this, we all understand that the trend is to take things out of the hospital that don't need to be there. Can we take, value-based care at its essence is pay more for preventative care to avoid downstream care. Let's pull things out of high-cost facilities and do these procedures in an ambulatory surgical center. Find, a cheaper place to go get your MRI. We're here in Boston. There's plenty of ways to get in trouble with overpaying for MRIs. How do we help guide those and help providers coach their patients to make the right decisions for themselves? And ultimately, this is all about driving better outcomes across the board. And why direct primary care and why is Athena caring so much about direct primary care? It's because direct primary care represents the optimal experience for driving consumerism. getting members engaged, creating the best experience possible for them. From an access perspective, yes, we're trying to pull people to the front door of healthcare, to primary care physicians, bolster that specialty so that, that very special moment that you have more time to spend with patients with longer appointment times, more mediums for communicating. That's all really important and has been talked about a lot throughout this conference. But it's also the fact that because they spend more time with you and have more touch points, they trust you and they expect you to help them navigate their tough decisions. Where do they go get care? Where do they get their orders? When they need downstream care, how do they know they're getting the right care, the necessary care, and to do it in an affordable way? And so that all ties back into driving financial and health outcomes, both at an individual level, but also at a population level. It is a great model, and it's really important to us. It is so important to us that we actually put some pen to paper this summer, and we actually signed a partnership with Hint Health. What we have here in our eyes, I've known Zach for a number of years now. I know many of you all on this call, and so many of your research talks have inspired me to understand and taught me the essence of direct primary care. But what we really want to figure out how to do with the movement, and specifically with Hint, this partnership, is figure out how can we jointly create a tailwind? How can we simplify transitions? Like, I've heard a lot of people be successful. I've heard a lot of people have some challenges or get scared about making that transition. And if someone's issue with transitioning is that their EHR won't support them through it, that's something that Athena has to help solve. And for those, we know there are joint clients of Hint and ours who are living in two different systems and we're not integrated. So we have to find a way to optimize that connection to create the best experience for providers as well as their patients.
First of all, welcome Athena to the Hint community. Generally speaking, the way we lead our partnership strategy at Hint, for the most part, it's driven by customers or kind of prospects that are asking us for things. And generally speaking, we don't invest too much energy into something unless there's already sort of pre-existing kind of value that's been delivered somehow. And in this case, there's been kind of a number of clients that have been working with Athena that have sort of increasingly been bugging both companies to figure out a way to partner so that we can streamline and kind of improve the experience. So I just excited to sort of welcome Athena to the community here. We've signed an agreement, and our development teams have started working on actually cutting code, or will be soon. And so that's So welcome Tim and welcome Athena, and we're excited to partner with you guys. So one of the questions came through is, what kinds of trends are you seeing within the Athena network regarding direct primary care? Are you seeing more practices make the leap? Is it static? What are sort of the data show on your side?
We're seeing about 2.5 entities, clients ranging in sizes transition a week. These are net new inquiries as well as existing clients looking to make that jump. That's a pretty significant number of clients when you add it up. And we've been tracking this since about the fall of 2018. And those are the averages that we're seeing over that time frame.
Cool. So 2.5 a week, that's pretty significant. Another quick question came in here. Can you please let us know how this partnership affects practicing DPC doctors? So maybe I'll take a stab at that, and then Tim, you can jump in. I think at the end of the day, it only affects practicing DPC doctors in that if you were already on Athena or wanted to use Athena, then there would be a sort of Hint Athena integration that really just streamlines that process. And so, it's sort of an optional thing. It's something that's been built for our mutual clients that want our systems to talk together. Tim, would you add anything to that?
No, I think you hit it well. And again, the point here is, what can Athena do to help the movement? Less so what you all can do for us is what we're really trying to understand, is like, how can we come in and play? And our customers have been demanding it. So we're responding as Zach explained, to the demand, and that's been growing.
Hey, so another quick question here. How affordable is Athena for a young practice?
Let's talk. So the reality is that I saw another question there saying, I think something along the line of, hey, I know someone who called in and had a bad experience, or we said we did not support direct primary care. To hit that head on, we have 5,500 employees. There's a lot going on at Athena. And part of the reason why I feel like we need to get out and speak more, my team, Naomi Pleasure and Mike Hanowich here on the call with me, we sit there and we have dedicated CSM and account teams for direct primary care, and we've had it in place for about a year. It is possible that you can get lost in a little bit of the big business red tape, but we are here. We have a distro list. If you stop by the booth, we'd love to share with you the best way to engage with Athena.
Thanks so much for all the support that you've been providing, and looking forward to continue to further this relationship.
Of course. And I did just, I know we're out of time, but I didn't want to end on an Athena pitch. That was not the point of this. The point of this is I do have 3 asks that we want to figure out how can we help the movement out. So please come engage with us, visit the booth, tell Zach, tell us. We'd love to understand how can we help accelerate, amplify the voice. I have some strong opinions, but as a product person, we're not supposed to solution. We got to listen to our customers, listen to our partners, and figure out how best to work together. So anyways, I hope you found this worth your time. Thank you all for your time today, and talk to you all soon. Thanks, Zach, for having us.